This video will discuss MICU multidisciplinary rounds. Why is this type of rounding important? It is important because it helps us to be more efficient, it helps us to be more inclusive by including all team members, and it helps us to enhance the plan of care for our patients. This video will provide some suggestions to improve multidisciplinary rounds within the medicine ICU. Let's first look at the MICU rounding team. We have the physician, nurse, pharmacist, respiratory therapist, physical therapist, dietitian, and possibly other consultants and team members. And by working together as a team, we can run the football down to the end zone and score a touchdown in the care that we provide for our patients. Here are some general rounding guidelines. The attending or fellow will act as the orchestrator and takes control of the flow of information that is presented during rounds. All team members are asked to concisely present patient information for the sake of time because there are 30 patients within the MICU that need to be rounded on every morning. An overhead page will announce the beginning of rounds every morning to make them official. MICU teams A and B will typically round together on new admissions, but may forego this depending on service acuity and census. The teams will then split up. If there's a really sick patient on their team, they will most likely go and round on that patient first. But then after that, Team A will start in the vicinity of room 1 and Team B in the vicinity of room 16 and move around the unit in a logical order. The way a patient is presented during rounds will differ depending on if it's a new patient or an existing patient. The rounding order for new patients. The provider or physician will present the patient first, and this will provide a history and background of the patient so that everyone can become acquainted with that patient. The nurse will then present their information, followed by the pharmacist, respiratory therapist, PT/OT, and the dietitian. The treatment plan is then reviewed, orders recapped, and followed by physician teaching. The rounding order for existing patient is just a little bit different. The nurse will present their updates first, then the provider presents any changes that occurred in the last 24 hours, followed by the pharmacist, respiratory therapist, PT/OT, and the dietitian. The treatment plan will again be reviewed and updated. Orders will be recapped, followed by physician teaching. Why is it important to include nurses? Nurses spend the most time at the bedside, and therefore they know the most recent patient information. It encourages collaboration by making the nurses feel like a member of the team and lets them know what is planned for that patient for that day. Why include pharmacy, respiratory therapy, PT/OT, case management, and the dietitian? Each group adds different perspectives and expertise. They all provide valuable specialty-specific input and feedback and suggestions to enhance the patient's care. And again, it encourages collaboration and teamwork by including all members that provide valuable care for the patient. We are going to review the nurse's presentation during rounds. The caveat here is that this is a suggested list, and the nurse really only needs to cover what is relevant for that patient. And again, it is important to be concise in how this information is presented. First, discuss change in status, anything that needs to be addressed immediately. Then drips and vasopressor requirements, pain, sedation medications, and daily awakening, CAM and RASS scores, ventilator settings and spontaneous breathing trial results, nutritional status and tolerance, eyes and nose and urine output, plan for mobility for the day, any additional concerns and issues such as abnormal labs, assessment issues, need for lines, etc. And lastly, family issues relevant to the plan of care. Door sheets can provide a checklist for what needs to be discussed, and we need to keep filling them out for each patient daily, for they help to ensure that important aspects of a patient's care is not missed. However, checklists are not a substitute for face-to-face interaction, so it is important that all team members are present during rounds. And remember, it's all about the patient. The goal is to identify small problems before they become big problems and to improve patient outcomes. Thank you. Woohoo!
created using Powtoon.